Today is day 3 of National Pain Week, and we're discussing the relationship between chronic conditions and headaches and migraines. And today we're talking about the Arnold Chiari Malformations. An Arnold Chiari malformation, also known as a Chiari malformation, occurs when there is a structural defect of the base of the skull, and essentially this area, the opening of the base of the skull, is either misshapen or is smaller than normal, so the cerebellum and also the brainstem become compressed. And also there can also be an issue with cerebrospinal fluid flow that can also create issues. So there are 4 classifications of the Arnold Chiari malformations, so from 1 to 4, with 1 having the least amount of symptoms and 4 having the most amount of symptoms. These malformations can be acquired, but most of the time, a vast majority of the time, they are congenital. There are all sorts of signs and symptoms that can come with an Arnold Chiari malformation. One of the biggest signs and symptoms is a headache with sneezing, coughing and straining. You can also get dizziness, hearing and balance problems, pins and needles, numbness, weakness. Neck pain is a really big symptom. Difficulties with speech or swallowing, tinnitus, so ringing in the ears, problems with sleeping, and also difficulties with hand coordination and fine motor skills. So as I mentioned as part of that list, then we do tend to see the Arnold Chiari headache as one of the major symptoms, and we also do tend to see an increased incidence of neck pain. It's one of the really common symptoms when it comes time for an Arnold Chiari malformation. But in those experiencing an Arnold Chiari malformation, we don't tend to see an increase versus the general population of headaches and migraines. So we do see that there are those with an Arnold Chiari malformation that do have headaches and migraines, but it's no more statistically than the general population that are experiencing headaches and migraines. So Arnold Chiari malformations haven't been shown that they do lead to or cause headaches and migraines, other than the classic and characteristic Arnold Chiari headache. So when it does come time for people who are experiencing headaches and migraines and an Arnold Chiari malformation, then these conditions are comorbid with one another. So they're not causing one another, they happen to be existing side by side. So in regards to treating the headaches and migraines in association with the Arnold Chiari, then treating the neck tends to be quite beneficial for those experiencing the headaches and migraines, because those with Arnold Chiari do tend to have a lot of neck stiffness and neck pain. So treating that does tend to help decrease the intensity and or frequency of the headaches and migraines. There are a couple of considerations that you do want to have in place for those experiencing an Arnold Chiari malformation. You don't want to do any forwards and back type motions, and also postures are really important for Arnold Chiari malformations because it does tend to make those headaches and migraines worse, and also Chiari symptoms as well. So good posture is key.